worked as a dentist for 25 years, and in his experience of being a dentist, realized that many of the transition companies out there didn't understand the differences in the way dentists practice.
Now, what about your land?
I think the brokerage industry that was out there at that particular time had no idea of the emotional roller coaster that any selling doctor goes through.
I guess it's an ego thing. I put my soul into that business, and I spent a lot of years developing the contacts that it took to build it. Some of those children grew up and had children and were bringing their children to me. That happened many, many, many times. I missed making decisions, people coming to me and asking me to solve a real problem. Some of the ladies that worked with me were with me over 30 years. I feel like they were family. I think that was the hardest thing. I don't miss grinding on teeth at all. I didn't miss that from almost the first month. But the other part, being with those children, laughing all day long, schmoozing with the parents, people that I saw every 6 months for years and years and years, I miss all of that.
Now, the buying doctor also goes through a lot of emotions about, is this the right time for me to own and get into ownership, or should I just be an associate the rest of my life? And I think we ask questions for buyers to determine where they are along that road.
It was very important to me that someone take over who could plug into that idea of treating people well, being friendly with them, getting to know them.
Oftentimes I think that buyers focus too much on the price. It's not about the price ultimately. What you're doing is trying to preserve the goodwill of the practice. You want the seller to stay involved and be eager to take your call on a Saturday night when you've got an emergency and you want to know the history on the patient. You want that relationship.
A bulk of the value of the practice is what's called goodwill. And it's a hard thing to put a price on, but when it's a practice like that where the patients have such a strong relationship with the selling doctor, the senior doctor, having that doctor's goodwill really becomes critical.
You want to maintain that goodwill in the whole negotiating process with this seller. And that goodwill is critical for the whole thing to work, so you get 98% transition of the patient base. So you don't want to damage the goodwill, but you do want to get a good deal. But you also want to look at this as a lifestyle thing, because once you buy a practice, you are in that practice for a very long time, probably 20 years, maybe 25 years. Now think about spending 25 years in a location you really don't want to be in. Children going to a school, you're really not sure that this is the best school system. And it's all because you got a good deal. And I want to help you not do that.
Anytime you have a broker, there's always an inherent conflict of interest when they're commission-based. You know, I didn't get that feeling with Bill that he was just in it solely for the commission. I felt like, you know, he would tell me when a practice, even though he'd make a huge commission on it, he'd say, you know what, this probably isn't right for you, you know, and I felt like he had my interests at heart rather than his commission check.
Then one of the things I find with a lot of buyers is that they get out of school, but they don't really know that they can go out and borrow the money to buy this practice. They think, well, I've got all this school debt. I can't afford to buy a practice. Well, we have to show them how this works with cash flows, with the appraisal of the practice, is how it's valued, what it means to them monetarily. We may work 2 months on background checks and getting the buyer qualified, turning him into a real responsive buyer, and the seller. And when they get to the table, it looks like and been convinced that this is the right buyer, and the buyer's convinced that this is the right practice to buy. But in the background, we spent 3 months getting them to this point.
That's the beginning. Okay, nothing really happens until somebody makes an offer for a practice, and then they were pre-approved. Now we have to get them formally approved. We have to get the buyer all of his insurances. We have to make sure the buyer can get a lease. We're probably talking to the landlord. Is he going to buy the building? Okay, how are we going to structure the contract? The contract in some cases is 80 pages.
The information that they compiled on the practice, the productivity of the practice, the expenses of the practice, showing what it was from a year-to-year basis so that I could get a feel for what it was going to cost. But without those figures, I would not have felt nearly as comfortable in going into this. And when I got in and reviewed, the figures were exactly what it was.
It wasn't so much, this is how much we think your practice is worth, and the first person that comes up with the cash, we're going to close the deal. That never happened. It was very employee-centered. They advised me on how I could break the news to my staff. And, they thought of everything before I ever thought of it.
I think that may be the greatest strength of working with Bill and working with Southeast, is that he's done this so much that he understands what a practice is, because a dental practice is more than just a business. And I think when someone has practiced like Bill, they understand that better.
For our practice, it was very, very easy. It was very smooth. The staff was fantastic. The patients are fantastic too, because there was a continuity in terms of how we treated people.
For me, whatever it costs in terms of their fee to do the transition saved, I mean, I can't even imagine what it saved in terms of time and headache and trouble, because they made it so smooth. This is what they do all day long, and so, you know, they were able to essentially make it an effortless transition, that if we didn't have them and we just tried to do it on our own, it probably wouldn't have happened, and if it did happen, it would have been with, I would be guessing, a lot of additional time and energy spent that we wouldn't have even known what we were doing.